Hi, everyone. I'm Sandra Levy. I'm senior editor of Drugstore News. Today, we're speaking to Andy Becker. He's recently appointed Chief Executive Officer of Fruth Pharmacy. Welcome, Andy. I'm so excited you're joining us today.
Thank you. Thank you for having me.
My pleasure. So let's get started. So, can you tell us what is your mission as the new CEO of Fruth Pharmacy?
Well, my mission is to provide the best pharmacy services in our region and to build on the relationships we established in the last 70 years to improve the health outcomes and the provider access in our communities. So we're expanding our provider-owned clinics in our stores, and we're working on improving workflow and communication to provide a more seamless experience for our patients.
Oh, that's exciting. So, West Virginia is a rural state, and healthcare deserts are real today. So, what will it take for the state to allow Fruth and other community pharmacies to deliver pharmacist-led healthcare, diagnosing common illnesses and perhaps writing scripts?
That's a great issue. So we actually have in place right now prescriptive authority for birth control. So that was the first step. We are doing that. That's been in place for a year now in West Virginia. Our governor just signed a bill into law that goes into effect here in June that will provide us limited prescriptive authority for flu and COVID with the approved test results. So we have the opportunity now to show what we can do for community health, just like we did with COVID. So hopefully when the results come in with these new authorities, we can expand that after we show the positive impact for public health.
Well, that's fantastic. So, what's an example of a legislative win that Fruth championed and won?
So there's a couple. So West Virginia has landmark law that other states are copying now for PBM reform. So this legislation established mandated minimum reimbursement levels based on NADAC plus dispense fee. It requires parity in payment for reimbursement. So PBM owned pharmacies cannot be paid more than they're paying everybody else. It provides protections for the 340B program for covered entities. It provides protections from the abusive PBM audit practices, and it provides for patient choice. The patient can go to the pharmacy they want to go to, not just what's mandated by their PBM. The other thing is state employee health plan, which is a huge issue in every state. So Fruth exposed millions of dollars in overcharging by the state's chosen PBM on the state employee plan. So we did help push through a law. It establishes transparency mandates in the plan. Every fee, every dollar, every rebate, whatever you want to call the shell game of dollars going on, has to go back to the state plan and not the PBM. It also requires yearly public reporting on the plan performance of these transparency metrics. And it mandates minimum reimbursement levels for pharmacy that's pegged to our Medicaid fee-for-service rates as the floor.
Wow, that's really impressive. So it's a segue into the next question. How Fruth has been able to work with local and regional players to develop programs that reimburse Fruth for doing more clinical work that improves patient outcomes and keeps patients out of ERs and saves costs for the healthcare system.
Yeah, we are actively exploring that, and we have been for years. And we've worked with several payers trying to come up with a solution. And it's kind of the chicken and the egg thing. You know, they want to fully realize results before they see them, and you got to get started somewhere. We just haven't seen any regional payers that are willing to put forth the money to make that happen.
So are there any new legislative efforts that you're currently supporting? And if so, why are they critical?
Federal PBM reform is critical for community pharmacy access. Um, State laws are great. They're hard to enforce because PBMs actively ignore state laws. They actively claim ERISA exemption on everything under the sun, even where it's already been decided by the Supreme Court that doesn't apply. It's going to take a federal effort to fix this. Plus, you've got Medicare Part D, which is a third of everything out there that the states can't do anything about anyway. I mean, there are good actors out there in the PBM space. It's not everybody. Ventegra, Capital RX, MedOne. Those are a few of the ones that do it right for the public and for the plan sponsors. But under the dominance of the big three, okay, 1 out of 3 retail pharmacies has closed in the last 15 years. I mean, that's astonishing. They're just gone, and it's accelerating. It's just the underserved areas like the ones that we're in, and we serve are the ones that are hit the hardest. And everyone in DC knows this is a problem. You can't consolidate all of healthcare and pharmacy into three global vertically integrated companies and think there's not going to be problems. These companies are using their consolidated market power to put everyone out of business that isn't them. And Congress needs to pass meaningful PBM reform now. America needs trusted community pharmacies in their neighborhood, and meaningful PBM reform is the only way to ensure it happens. These pharmacy deserts that everyone reads about will be pharmacy wastelands if Congress doesn't act now.
So you have your work cut out for you, that's for sure, in order to do that. But it's uh, it's wonderful that you have your pulse on what's happening and trying to get efforts, legislative efforts going forth. But what new patient facing services are you offering at your pharmacies today?
Well, it's something that we're actively working on now to roll out, and it's complicated and convoluted to do it right. But we want to leverage new technology to provide secure mobile phone communication between our pharmacists and patients directly. Save time, save effort, and people need to know what's happening with their prescriptions. They want to know what's happening at all times to be able to provide a good experience for them. So we're working on that.
Well, that's exciting. So what's your view on how pharmacy can play a bigger role in these underserved areas?
Great question. So playing a role in these other served areas and showing what we can do, it comes back to access, right? So that is back to the PBM reform that's necessary. You have to be in the community to provide for the community. So pharmacists, everybody knows it's been this way forever. Pharmacists are one of the most trusted professions. We remain the most accessible healthcare professional in the community as long as we're still here. And we're often the first healthcare professional contacted for advice by the public. We're a focal point for triage in these underserved communities. And it's also back to test to treat. It can take stress off an underburdened healthcare system and dramatically improve health outcomes with rapid testing, treatment, and patient monitoring.
Thank you for sharing your insights. I really appreciate it. I know you're very busy, and congratulations again on your new appointment as CEO. We hope you'll come back and share some more thoughts with us.
Thank you. I appreciate it.
My pleasure.